Going to resume the recording. All right, everybody. My name is Kimberly Ernest. I'm a licensed psychologist and licensed professional counselor here in the state of Pennsylvania. And today we are going to be talking about telemental health and all of the wonderful ethical guidelines associated with it. As you all have read in your email, I sent you an attestation. Please read, review, and sign. Not all of it will apply directly to you, but because we have a number of grant-funded programs and a number of other bizarre kind of niche programs going on, we wanted something to sort of capture everything so that everyone will be covered moving forward. So I'm going to review right now everything that we have to, and I'm going to share my screen with you all. So hopefully everyone can see that. Is everyone seeing my PowerPoint at this point in time?
No.
How about now?
Yes.
Perfect.
Yes.
Perfect. All right. And hold on. All right. There we go. There we go. All right, everyone. So I got to move that over there. Sorry. I have had a crash course in Zoom these last couple of days. I will tell you what. Okay, so we are going to be talking about the ethical use of telemental health. So the very first thing, and the thing that we're seeing a lot of concerns about from a insurance company standpoint, is that if individuals are operating remotely, or if individuals are not having clients come to the clinic, how are we certain that individuals are being seen for the appropriate length of time? Because of course that is the primary concern right now. It is important that you ensure your clinical documentation accurately reflects time in and time out for the provision of essential services. The method of provision must also be accurately documented. So if you are seeing somebody on the phone, you need to document phone. If it's internet, it must be documented as internet. If it's in person, it must be documented as in person. The outpatient progress note should be updated to reflect that. So you have those little check boxes. Make sure you're checking the right box. The provider must complete progress notation within 24 hours of the completed progress note, and it must be accurate. At the end of every week, as our backup, we're asking you to provide your doxy.me log, which can be found in your Doxy account, as backup for sort of everything. So we have that as a secondary thing for billing purposes. If it's on the phone, obviously that's not going to be on doxy.me, but it's the best we can do. So when it comes to technology, we are encouraging our providers to only use equipment and programs that have been either approved by PCS, such as a webcam at your office computer or laptop provided by PCS. We ask that you do not connect a non-PCS device to the PCS network because we're concerned about individuals' personal health information being compromised during this time. What we have been seeing is that there is a market increase in cyber attacks going on right now. I guess probably because there's opportunity for it. So please be mindful that you're not connecting your home devices onto the PCS network. Additionally, the doxy.me, the doc hub that we are in the process of rolling out, and a couple of other things are all HIPAA compliant, and we're trying to remain within those guidelines. We have gotten some word that mental health guidelines are going to be a little bit more lax about HIPAA compliance, but we are kind of choosing to, all things being equal, doing our best to ensure we are not being lax about HIPAA compliance. I'll talk about that more in just a second. Prior approval for telemental health to ensure coverage is important. So if you need any help to ensure that your client qualifies for telemental health, talk to Tiffany. Perform Care qualifies and CCBH qualifies. So those are the two big ones. However, when it comes to the provision of group through telemental health, we're running into a bunch of barriers with DDAP right now, as well as when it comes to like group sizes. Obviously, we're trying to cut down groups to maintain healthy social distancing. So our recommendation at present is that if you cannot, and I say at present because I feel like I've heard like 3 emails since I've started this presentation, which obviously means probably everything changed. But at present, the rule is if an individual is at risk and can't come to group for whatever reason, please schedule an individual session with them with the same treatment dose as is written in their treatment plan. So informed consent. You've got to talk to your client about the barriers of telemental health and how that overlaps with HIPAA compliance, and essentially get their permission to participate in telemental health treatment. Um, in certain situations, if you can't get that signature prior to seeing the client, we have gotten word that that is okay. However, then you need to get the signature at the next physical contact, or be communicating with your admin to get it electronically. Regardless of whether or not the consent is signed, it's essentially that you kind of talk to your client about the increased risks to confidentiality, and that you are documenting that conversation somewhere in your progress note. So basically saying it's been reviewed and you are, the client's on board and everybody agrees. I have seen, so I'm in a number of different like online groups for mental health professionals and people in the field. And one of the very common misconceptions presently seems to be that like HIPAA doesn't matter anymore and that it's the Wild West and you can do whatever you want. That is just not true. Um, First of all, when it comes to drug and alcohol, no, there have been no relaxation of those specific regulations. So every drug and alcohol client, they are saying we will still get prosecuted for any HIPAA violations. For mental health, there is a little bit more flexibility. For example, they're giving permission for staff to like use FaceTime and things like that that are not HIPAA compliant platforms. We have Doxy.me. I would encourage you to use it. For most of our clients that are medical assistants, we can use phones instead. So I would always encourage you to go with a phone over a non-HIPAA compliant software. I just think it's better for all parties involved. It is important that as the provider, you are providing services in a location that is private and the information is being kept confidential. At present, the MCOs are saying that they expect the providers to be providing services from the office. But I think we also are all realizing that the situation is quite fluid, and we're going to do whatever we need to do to ensure our clients are getting care and not going without it. So the provider will need to communicate to the client that they're in a private location and ask the client to do the same. However, we only have so much that we can do about clients. In order to provide, your audio and video should be working. If for whatever reason it's not working, shift to something else like phone, if at all possible. Medicare is actually a hard no on providing phone services, which is mind-blowing, because those are our older adult populations that have a tendency to struggle a little bit more with technology. But at present, those are the rules. So again, please, the situation is fluid. Stay tuned. Hopefully we can get an update on that. We have applied for a phone waiver for Medicare, basically saying that technology will be a barrier with that population. When you do connect with the client, I would always encourage you to confirm your callback number and discuss a plan to reconnect should your technology stop working. We've been in communication with the Doxy.me folks, and they said they went from around 2,000 signups a month to a little over 20,000 a day. So that number is a dramatic increase. They are scaling to meet demand, obviously, like this is their moment. And I'm sure they want people to have a positive experience so that we continue to use them after this. But right now they are still scaling. So give them a little bit of time and grace. And if you haven't been playing around with Doxy.me, I would encourage you to. Talk to your clients about this shift. We know that the secret sauce when it comes to good clinical work is the therapeutic relationship. We recognize that some clients are not going to feel comfortable with the new telemental health technology. So talk to them about some of those barriers and maintaining safety and all that kind of good stuff. Ensure that you are continuing to maintain clear professional boundaries about communication, even though a lot of things are changing about our communication and technology. While we are communicating now from laptops and computers and other things, we still shouldn't be using social media or chatting with clients or emailing back and forth in a therapeutic way with clients. I think it's still important for us to maintain clear therapeutic boundaries about the therapeutic relationship. In addition, you must apply all of the same ethical guidelines for telepsych as you do for face-to-face sessions. So the rules remain when it comes to ethical relationships with clients. And if the client is presenting in crisis, it's still important to make those emergency referrals. I know that right now, probably the role of mental health and drug and alcohol professionals within the COVID-19 crisis, our primary objective is to keep clients out of the ER because the ERs are likely about to get quite busy. However, if that's where the client needs to go, we still need to make sure the client ends up there. Anytime a provider is feeling uncomfortable about the use of technology or feel like it may not be appropriate with that specific client, please seek consultation or supervision. Carl, Crystal, and myself are going to make ourselves super available over these next couple weeks as we roll this out, because I realize that our clients' crises are likely going to be increasing during this time as well. I'm going to start trying to join you all in your Zoom meetings, so that should be fun. But also I am available to anyone if you need a consult, and Carl and Crystal are busy. Also make sure your CPT code reflects the amount of time that you're spending with the client. So let's say you were planning on doing a 45-minute session, but 20 minutes in, the internet breaks. I don't know. Doesn't seem too far-fetched at this point in time. If about 20 minutes in, the internet goes down, please change your CPT code to accurately reflect the length of billable service. I got really good news like 30 minutes ago that state lines no longer matter. So we were really concerned, and this is only temporary, but legally you are not allowed to practice across state lines. And we have some clients that live in Virginia or Maryland or West Virginia, and they may be choosing to stay home and use telepsych. The state lines have been temporarily lifted. And should anything change as a whole from an outpatient perspective, and outpatient staff are remaining home and providing services through telehealth, I know we also have staff that lives outside of the state and commute in, so that also will not be a barrier. So the good news is, at least temporarily, that's not a barrier. Here are all the resources. I strongly encourage you to read through them, especially the APA. That's it. Any questions? Sorry, this feels very rushed and sloppy. I put this together.
So I just want to confirm, we're not supposed to use our own computers now at home to do
One more time, Sue.
a session.
What'd you say?
I just wanted to confirm we are not supposed to do a session at home with our computers now, our home computers.
Not right now. However, that situation is fluid. And if you have certain risk factors that you are concerned about, talk to Tiffany Dreher. Right now,
I'm waiting for verification that one of my clients saw a couple
So you're cutting in and out. Would you mind maybe typing it down there? SBO staff. Yeah.
Sure.
So we're still expected to come in if we're still available to do sessions.
As long as you are asymptomatic, yes.
Okay.
If you are symptomatic, if you have been tested, if you have reason to believe you are exposed, if you are awaiting test results, if you have a close family member, or if you fall into a high-risk category, I would strongly encourage you to reach out to Tiffany Dreher. However, at present, the MCOs are saying they expect all of our staff to be on site in the provision of remote services. So we cannot roll out a systematic carte blanche, everyone can work from home. However, if you are concerned, I would strongly encourage you to talk to Tiffany Dreher.
Does this count for trainings too, or just telepsych?
No, for your trainings, you can log in at home.
Okay.
Yep. And I think Adam sent that out yesterday, but I also recognize you have 7,000 emails right now. But yes, I think as of yesterday, we were able to say everybody who's logging into trainings remotely, do it from home.
Okay.
Sorry, there's a typed question. And then Marianne, you also raised your hand. I don't know how to help you, Marianne. Hold on.
Go. You can do the typed question first if you want.
Hey, you're there. No, I can hear you. What'd you say?
Okay. Is it true that for Medicare, we're not allowed to open any new clients at all? Because I have somebody who I had previously worked with who had a baby and's coming back to services, and she would prefer the video.
So we are not at present permitted to do intakes through telehealth.
Like across the board.
Not necessarily.
Okay.
So right now the MCOs are following an OMSAUS directive that basically said all of the rules that the MCOs were previously following no longer apply. And so we're going to take that to say that we can continue to do that. We can do telehealth intakes for Perform Care and CCBH. We realize that that might bite us, but we would rather serve the clients. However, Medicare has explicitly said no.
Okay, gotcha. But she could come into the office for the first session and then from there on out be telehealth.
Bingo. Yes, absolutely.
Got it. Okay, thank you.
And Katie said, I have a question. If we were using Doxy for most of the session and towards the end we lose them and finish on the phone, should we still bill for it being online? Yeah, I think that makes sense. Bill for it, select online, and then maybe just somewhere in the body of the note, document that to reflect that halfway through you had to shift for some reason. Any other questions? Anybody else? Do you think insurance companies will hang on to the service even after this? It would be nice in times of inclement weather. I would love that. Everything that we are doing now as a leadership team is to allow us to sustain these practices for the foreseeable future. So whether this social distancing or social isolation thing goes on beyond the next couple of weeks, we want to be prepared for that. Mike, my husband, Mike, also IT Mike to some of you, has been working to get all of our intake documents up and available on DocHub so that even in the months that follow, and even when life is completely back to normal, and I know it doesn't feel like it right now, but I'm certain a couple months from now or a year from now, we'll be thinking about, you remember that time? But what we are actively working to do is get every single intake document on that DocHub so that clients can get that remotely during this time, but then also in the future, they don't have to arrive 45 minutes early. They can do it all online. So the different systems we're trying to put in place now, we're hoping that they will extend on beyond now. Now, like practicing across state lines, that was an emergency declaration from the governor. I don't see that lasting. And a couple other things. Can we email worksheets we want to do with telemental health clients? Yes, you can. You can either email that to the client directly or have the client email or have that sent through the DocHub program. However, give us a chance to get essential documentation on DocHub first, because that you can't just, like, we've made a DocHub for each clinic, but now we need to go in and create every single document within each clinic. You can't duplicate it across accounts. So we're presently trying to create about 300 documents, and you have to enter all the text fields and signature fields. It's actually really time consuming. So give us a couple of days to get caught up with essential documentation, and then we can go that direction. If a client states they're not comfortable coming in and has already sent back the informed consent form, is it okay to wait until the first telehealth session to review it, or should we call to review prior to that session? You can do it in the first session. Absolutely. No need to call and do it prior. Any other questions? Going once. Going twice. All right, everyone. That's it. Can you share the training with me? What training? Can you share the training? Oh, my PowerPoint? The first one. The PowerPoint? Working with kids, crisis clients. Carmen just email working with kids. Yes, yes, yes. It should be somewhere in your email, but I can send you the direct link because I actually know where it is. All right. Any other comments, questions, concerns? All right, y'all. Thank you so much for your time and attention and energy and how hard. Yes, you can finish on the phone if you lose them. Absolutely. Absolutely. Right now, I feel like we have to follow certain ethical guidelines, but I think paramount and of most importance is ensuring that our clients are safe and cared for. And after that, we'll clean everything else up in the wash. But right now, I just want to make sure our clients are safe and cared for. All right, everyone. Thank you all. Tiff is doing a series of Q&A for everyone who's confused, which I suspect will be everyone. So please reach out and don't hesitate to ask questions. But otherwise, thank you all for getting through this week with us. I know that this week has not been easy. Please be mindful of next week on Friday. We are setting up a sort of self-care and wellness training. It was the one that Tara Byers did a couple of weeks ago. It's phenomenal. I would highly recommend doing it. But that should be posted on the Hub training calendar towards the end of this week, and it will be next training live via Zoom to just try to give everyone an extra layer of support during this exceptionally stressful time. I know I personally feel like I'm in the middle of a war, and so I imagine that others are feeling that same stress. So any way that we can support and help you, we are here for it. I appreciate you all. I know that this has not been an easy week. I want to say next week will be easier. I don't feel 100% confident about that, but I think we are definitely driving towards some systems that will feel easier and reduce the stress moving forward. So thank you all. Thank you all. Thank you all. I hope you have a wonderful rest of your day. I will talk to you all later. Bye.